Hi, so my name is Dr. Laura Stachel. I'm the Executive Director and the co-founder of We Care Solar. And We Care Solar is a nonprofit organization that has a base in the United States, but really an international reach. And our mission is to really light up safe childbirth in countries that don't have reliable electricity, in particular to try and save the lives of mothers and newborns. And today what we'll be focused on is the power of leadership. This is the 9th week of our 10 by 10 anniversary series. We're celebrating our 10 years of existence as an organization, 10 years of saving lives in childbirth, 10 years of actually empowering women as leaders, because one of the tenets of We Care Solar is that we really do see women as leaders in the clean energy revolution. And today we'll be meeting with board members from We Care Solar. We have 2 board members, both of whom were born in Africa, but have been living in the United States for some time, and they'll both be sharing their leadership journeys. I think all of us were very excited this month when Kamala Harris was elected the first woman vice president in the United States. And I think she really had a powerful message about leadership. When she spoke last weekend, she said, dream with ambition, lead with conviction, see yourselves in ways that others may not, simply because they may never have seen it before, but know that we will applaud you every step of the way. And I think she was in particular talking to young girls, young women leaders, trying to really provide some encouragement and some modeling for women that may not have actually imagined their own potential as leaders. We really want to be examining the question of leadership today. And to do this, we're going to be talking to 2 of our We Care Solar board members. First, we have Ndola Prata. She's a physician and a medical demographer who is working at University of California, Berkeley. So Ndola is actually the director and chair of the Bixby Center for Population Health and Sustainability at University of California, Berkeley. And I'll just mention that We Care Solar started a little over a decade ago because I was an intern for that very same institute. They sponsored my trip to Nigeria, which actually led to the research that was the sort of founding pillar for We Care Solar. Ndola is also the professor in residence for maternal and child health, and she co-directs Innovations for Youth and the Center of Expertise on Women's Health, Gender, and Empowerment at the University of California, Berkeley. She began her career actually as a demographer in Angola. She worked for 10 years as the head of the Social Statistics Department at the National Institute of Statistics in Angola. Shortly after moving to the United States, while beginning her tenure as a researcher and lecturer at UC Berkeley, she actually served as a demographer for the CDC's Division of Reproductive Health. She worked there for 6 years, and then briefly later, in 2010, she resumed that position. Her current research is based in sub-Saharan Africa. She's especially interested in women's health and empowerment and maternal mortality. And in particular, she conducts research on family planning, on the distribution of contraception to underserved populations, on safe abortion, on maternal and adolescent sexual and reproductive health, and on the use of a drug called misoprostol, which has been shown to markedly reduce postpartum hemorrhage and has been correlated with dramatic reductions in maternal mortality. She earned her medical degree from the University of Angola and has a Master's of Science in Medical Demography from the London School of Hygiene and Tropical Medicine. So, Ndola, I want you to say hello so the camera gets to see you for a moment.
Hi, hello everybody. It's a pleasure to be here with you today.
Great. And our second panelist is Maame Afon Yelbert-Sai. Maame embraces her calling as a consummate connector and networker. And she's the founder and the chief steward of an organization called MILT, which stands for Management for Impact, Leadership, and Transformation, which she founded in 2017. Maame, it's hard to describe her without providing a lot of different adjectives. She's an activist, a facilitator, an executive life coach, a mentor, a performing artist, a passionate advocate, an environmentalist. She works at the intersection of women's leadership in the environment, health, politics, and works for social change. And she actually uses her performing arts as a singer to really work for social change and philanthropy. She is currently the chair of We Care Solar Board. She's also the chair of the African Women's Development Fund, USA, and sits on the board and advisory council for numerous other organizations. She holds a BA in French and Spanish and a master's in human rights, gender, and international development. She's been named among 100 African women in development by Donors for Africa. She was also recognized as one of 18 African feminists for Harriet in 2015, and she's been the recipient of numerous fellowships, including the 2020 Perennial Fellowship, Rise Up Leader, Hive Global Leader, Cordes Fellows, and the 2009 Women Leader for the World, which is where I got to meet her. And in addition, she enjoys her calling as a wife and mother of 3 children. So I am really impressed with both of you. I'm so honored to have you on the board. And I think that one of the things that we've been trying to think about is, how do women become leaders? You know, you both are doing quite incredible things in the world, but I know that you started in a very different place in your lives, in your own countries. And I would love it if each of you could talk a little bit about your own journey, starting with your childhood. Maame, could you talk a little bit about where you grew up and what your childhood and adolescence was like?
Yeah, so thank you so much, Laura. And thank you everybody for showing up to this session on the power of leadership. So my name, Maame. If you're familiar with the continent, my name should place you in West Africa. I am a proud West African woman who happens to be from an amazing country called Ghana. So that's where I was born and raised, in Ghana. And you know, speaking about leadership and my childhood, I think that, you know, just growing up, I always found myself thrusted into leadership spaces. So in middle school, going forward through high school, you know, I was able to play certain roles. So I was a girl's prefect, for example. I served as village outreach president, which meant that we're going to the communities around us. So if you know anything about African systems in terms of education, we have a lot of boarding schools. So I grew up, you know, being in boarding school, away from family, you know, in a different region. And within the communities that surrounded us, I found myself doing work with the village outreach, where we're talking about awareness and education and all of that. And being the oldest daughter, you know, leadership was thrusted in that sense, because everybody had to look up to you. You had to be the example for your younger siblings. And then also just having responsibility of, at some point in my life, I lived with my aunt who has 4 sons. And I, as the girl, and being the, you know, the woman within the gender construct of how things are, I had to take care of my younger cousins. Also, you know, when I came to the US and when I was working at the Global Fund for Women, and I had my kids, and at some point I was thinking of, how do I merge my life as a leader? How do I merge the elements of who I am? Because I noticed that I was showing up in silos, you know, so at one point I'm a mom, at one point I'm a career woman, and I wanted to merge all these elements of who I am. And that was when I went through the Women Leaders for the World program. And I think I see Linda Alapin on here, who is the founder of that program. And that laid the foundation for how I show up as a leader. And so I often tell people I'm a whole woman. I think of, you know, the exposure that I have gotten, even from my mother. My late mother, you know, really modeled for me in very, very simplest form what it means to shift narratives and break stereotypes. And basically in doing that, she laid for me a very solid foundation. So right now, when I think of my leadership, I think of what it means to have a sound and healthy foundation of leadership, which is what I do and who I am, you know, in the spaces where I show up. So that's a little bit about my own leadership journey.
Thank you so much, Maame. Ndola, could you talk to us about your life beginning in Angola?
Yes, thank you, Maame. We have quite a bit of similarities in our life's journey. So I was born in Angola. still during the time where Angola was being colonized by Portugal. So it wasn't until I was 10 years old when, around that time, when Angola became independent. So, but I saw from the early beginnings that I did have the support of both of my parents to pursue my dreams, to pursue my goal of staying in school, and sort of education was always prioritized in my family. And then later on, with the support of the more extended family, including my grandmother, so it was visible the sort of the support that I was getting from them, but it wasn't always sort of an easy strategy. Economic circumstances, other family circumstances, a lot of barriers that could have sort of prevented me from continuing to pursue my education. So I give a lot of credit to my parents and also my extended family for making me stay focused despite all of the problems. Many of you might remember that Angola was independent when I was, as I was saying, when I was 10 years old, but then we embarked on a civil war that lasted until 2002. So it was really sort of a difficult situations, not just politically instability, but hunger, lack of, like school year that was abolished and things like that. But here I am. It does take, like they say, that you've heard many times, takes a village. But also I drew a lot of strength from also seeing the pain and suffering of the women around me in my extended family, but also in the communities. And that's what drove me to pursuing medical education. And within that, focusing on maternal, sexual, and reproductive health, because I was drawn to all of the experiences of the women and how difficult it was, for example, not to get pregnant when you are poor and have poor access to services, and also in most circumstances, even lack of knowledge about what to do when you don't have money to go to the doctor. So we'll talk more about it.
Yeah, I think it's interesting that you brought up the issue of barriers as well as facilitating factors. And I think, for actually all of us on this call, it was never a given that we were going to become leaders. It was never a given that we were going to try and change the world around us. And I think for all of us, our adolescence is probably one of those periods of time where there's a lot of things we see, we learn, that we digest, and those seeds start to get planted. So can you both talk a little bit more now about potentially your adolescence and even your young adulthood and some of the things that you encountered in your lives that you think may have planted the seeds for your eventual work in life and your role as women leaders? Maame, would you like to start?
Yeah. So especially when I think about when I lived with my aunt. Well, I'll go back a little bit to high school and thinking about some of the barriers that you were talking about and the challenges. I remember that in high school, because of how we talk about reproductive health rights, because of the cultural, factors that sort of are connected to reproductive health rights, things about sex and other things, sex education, it was almost a taboo. You don't talk about sex, if you talk about it, then perhaps you're a bad gal, you can't talk about it. Close your eyes. If you're watching, for example, a movie and there's a scene, of somebody kissing, and you were with your parents or other elderly people, they might say, close your eyes or get out of the room. And so there was a certain myth around this idea of sex education, right? And because of that, I think Ndola mentioned it, people didn't have the awareness and the knowledge to be able to make the right choices and the right decisions about their reproductive health right. And so in school, for example, if somebody got pregnant, people would go for abortions, but often they wouldn't go through the right process. And the factors that will make them go for abortions could be, you know, I don't want the stigma, you know, I don't want people to look at me a certain way. There's a stigma that is associated with that. And so, you know, I saw a few of my classmates who had abortions, and some of them actually died, you know, so I saw that. And just even as a woman, as a girl, as young as I was, living with my aunt, because I was a girl, I had the responsibility of taking care of my cousins, you know, when it comes to even education, right? And so we would all have to go to school, but I would have to wake up in the morning, make sure the younger ones are taken care of, you know, sweep, you know, clean the house, do all of those things before I could, you know, get on to school. And yet I was expected to also show up and do well in school. And so these factors really shape, for me, they shape me in a very resilient way. And so I was always looking at those things around, and then even growing up with a single mom, right? To see how she had to break barriers, how she had to deconstruct and dismantle some of the perspective of what it means to be a single woman and raise, you know, a whole community, you know. It was very interesting to see that. And those things sort of pushed me into asking questions, into leadership, into being very critical about what I see and how I see it, and how that impacts who I am in the world and what other people as other women have to deal with. And so that would be, you know, some of those things. And I think that resilience for me has been part of taking very bold decisions, very bold and audacious decisions, right? And so, for example, after high school, I told my mom I wanted a different experience for college. And so I went through a process. Initially, I was going to go to England, and somehow I didn't get there. It's a whole story about visa story. They were like, yeah, we don't think you are genuine enough to be given a visa. So I ended up coming to the US, and I found myself in Iowa, of all places, in the middle of nowhere, a small town called Decorah, Iowa. And that experience, living in Iowa, and then as a French and Spanish a student, living in France and Guatemala, all of those things gave me a global mindset that shapes how I show up. And so those are some of the things that I can speak to in terms of my childhood, what I saw, and how those experiences inform and shape how I show up in the world today.
Thank you, Maame. So much there that I think we can relate to. And Ndola, I know that there's a number of things that Maame touched upon that actually were very relevant to your life as well, the kind of secrets that you saw happening in your family around reproductive health. Can you speak to some of that and some of the issues you saw that actually shaped your pathway and the things you wanted to really accomplish in your own life, please?
Yeah, so just to let you know that when I was an adolescent, sort of one word that could describe me would be troublemaker. But in today's world, you wouldn't call what I was doing at the time to be a troublemaker, but maybe you would. Mm-hmm. So I was, as Maame explained, as you know, being the first child of 6, you take on a lot of responsibilities since the beginning. I started cooking for my family at the age of 8. You know, taking care of my brothers and sisters, even when my mom was sick, taking care of her. So it's a lot of responsibility. In one way, you might feel it as a burden, but in the other, the way I took it, it was like the confidence that the adults had in me to take those roles. And I saw it as, today, as I look back, you know, I was already being trained to be a leader, to respect others, to take care of others. So that it sort of together with sort of what I saw around me in terms of injustices, including within my own family. And that was the word the troublemaker comes from, in terms of equal rights, equal opportunities, but also gender norms and cultural norms that sort of perpetuate those inequalities and the ability to stand up and speak for yourself. So I was slowly challenging all of those. But at the same time, the more ability I had to speak up and voice my be able to be heard and voice my concerns. I always learn from those circumstances on how best to make your argument, you know, without arguing or crying in the middle. So I was taking all of those lessons as important lessons that today I see as, okay, so that was a small leader in the making. The responsibility to others is something that from very young age, because I started working towards that very young. I have to tell you a story that just crossed my mind. I remember I was probably 11 or 12, and there was civil war in Angola, and you have to line up for food sometimes for hours and then don't even get anything. So this particular day, my mom wasn't feeling well, so I went by myself. Very far away from home. We were living in what you would call here in America today, like the projects, but our projects didn't have paved roads. So I went to this shop that was in the city. So as I was coming home with this bag, I was so happy that I have this bag full of stuff for my family. You know, the violence started. You know, like in the neighborhoods, there were shots. I mean, you couldn't understand who was shooting whom or stuff like that. And everybody just leaves their stuff on the ground and run. You have to run for cover. And what I did is that I took that basket of goods, I put it in my head, and I run with the basket of goods. And my mom, when I arrived home, because it slows you down, of course, it was heavy. And my mom was like, why didn't you just run? You could have been shot and everything. But the only thing at that moment, as I was hearing the shots around me, was you need to get this food home for your brothers and sisters that were much younger than me. And my mom that was unable to go out to look for food. So those are the small sort of marks in your life that really shapes and allows you to become a leader, and the dedication to fight for those who don't have a voice or don't have the same platform to move forward. With respect, for example, Laura, if you allow me, to sexual and reproductive health and why I focus on that, I did see very close to me, but also in the community, and in the beginning when I was what I like to call myself a young physician in the community, it's just the struggle that the poorest you are, you have to control your own fertility. And yes, you might have a desire to have a family of 4 or 5 or 6, but you need the spacing between that. You don't necessarily want to be pregnant every single year. So, but the struggle to keep your, births apart, the struggle to, when you don't want any more children because you have your desired family size, to be there, but even the struggle to have an unwanted pregnancy and want to stop that pregnancy that in many cases, including in my own family, can lead to death, is what, inspires me to continue to work in the area that I work of maternal health and sexual and reproductive health.
Wow.
And Laura, let me just add one more thing to this part or aspect of our conversation in terms of leadership. One of the things that I saw just firsthand was this idea that as women leaders, or the leaders, the women I saw, as leadership example, I saw that a lot of women leaders were compartmentalizing their lives. And so to show up as a leader meant that, you the mechanisms to be able to bring your full self, what I call being a whole woman, bringing all of who you are to every experience, right? So you are bringing your trials and your triumphs, your fears and your tears, your intellectual capacity, your faith, you know, everything, the things that you are passionate about, the things that you believe, you know, make you come alive, what your calling is, your experiences, whether it's educational, the legacy you want to leave, you know, how you want the world to be a better place because you are in it. I noticed that those mechanisms were not there. And so earlier on in my own career, when I was working at the Global Fund for Women, for example, I would show up in one space and, you know, I would wear my wife hat. And then sometimes I would wear my program, you know, professional hat, you know, program associate, program officer hat, right? And then sometimes I would also wear the hat of like being this mother. And I was looking for a certain kind of alignment and connection. How can women unapologetically show up in the fullness of who they are, where we are not siloed or we are not compartmentalizing our lives? Because when that happens, then we are not able to be the efficient and effective leaders we need to be, you know, when things are in tranches. And that's why I'm so grateful for my experience in 2009 from the Women Leaders for the World program, where I met you, Laura. That gave me a container to be able to show up in the fullness of who I am, to bring everything that makes me a leader. So whether it's my soft skills, whether it's my technical skills, whether it's about talking about even my core values and what it means and how women lead, all of those things are important. And I think having that container and really beginning to build a movement for women to show up unapologetically, authentically themselves, it is so key for women's leadership, you know, especially now.
Thank you both. Maame, when you talk about whole woman, you know, you definitely manifest it. I mean, it's really wonderful to see how you bring that and you model it and you give all of us a chance to emulate that. I think a lot of times we talk about authentic leadership. You know, what does it mean to really be authentic? On Facebook, if people want to go to our Facebook page, one of our other board members, Ndola, she actually did a recording last night, and she was supposed to be originally on this call and had a conflict. So I said, please share some of your thoughts. And she talked about being authentic. And she said, you know, you may not have people follow you. People may or may not actually want to join you, but you will at least surround yourself with the people that will join you, that will, you know, care about the things that you're caring about and really be able to push forward in a way that feels authentic to yourself. So that's one of the things I thought about. The other thing I thought about, Ndola, when you were speaking, I love the story about carrying the food to your family. And what it really made me think about was taking risks. Mm-hmm. And I think as women leaders, we often really need to step up and take risks. And as you were talking about that, I was thinking about the first times that I was in Nigeria trying to bring solar suitcases to where they go and literally being stopped by police officers while I had that suitcase. And there was nothing that was going to deter me from getting that suitcase to the health center that needed it. And I once had some board members with me that were visiting, and they were in a car when one of these officers came, and they were like, what were you doing? You just put all of us at risk. And it was like, I was so determined just to get to where I wanted to go. I didn't even think about it. It was like, those women need light in that health center right now. Mm. And I know that another board member, Gigi Goldman, also made a video that's on Facebook this week, and she talked about risk taking. So I just am thinking about that as you're speaking. Maybe, Maame, you can think about your own risk, just leaving your country and going to Iowa. I'm sure when you got there, you were probably questioning, what am I doing?
That's right.
But it's almost like there's something deep inside us, right? That is a passion that's so strong that it propels us forward. Mm-hmm. I'm going to ask you next to really reflect on more of the lessons that you've learned in your own leadership journey. Maame, you've already talked about a couple. Mm-hmm. Ndola, what about when you think back, and then I'll come back to you again, Maame, but Ndola, what are some of the lessons that you feel that you've learned along your own pathway towards leadership?
Oh, so many, Laura. So many less. I even learned about myself, more about myself. But some of the things that I wanted to share with you is that the path there takes a lot of work. Takes also it requires from us courage, dedication, being authentic, as Maame and Laura already mentioned. But always think about who could be your allies, who are your supporters, how you convince those that might in the beginning not be your supporters. How do you articulate the message in a better way in order to be heard so you can gather more support? So all of that, learning all of that at the same time that you're focused on the key objective. And for me, for example, it was whether it was associated with a specific condition or a specific disease, is to improve maternal and sexual reproductive health. So once focused on that, the lessons along the way might differ from many of us, but also one great thing that I learned is that everybody matters. It's not just because you are a university professor or you are a leader of an organization or you are on the board that the people around you with the same profile would matter. Every single person matters.
Right.
I give you an example. For me, it mattered and it kept me focused and energized every time I was fighting for something that took a long time to come to fruition. And then I would go back to Africa, and just conversations with simple women in the community will spike so much energy in me. Let me give you an example. I was working very hard towards increasing access of community distribution to modern contraception, so women will have the ability to decide when and how many children to have. But to do that, we had to actually use community health workers because not everybody has the ability to get to the health center. And health centers have a lot of diseases to take control. So I designed trials to see the safety, the effectiveness, and the acceptability of using those contraceptives by being distributed by community health workers. But now it's like the World Health Organization recommends it, many countries are doing. But during the fight, when you are trying to propose and people are questioning you, like for example, so you want farmers to give injection to farmers? You know, like those types of questions. But then you go back to those communities and you ask, okay, so let's just talk about what we as among women doing, you know, coffee, what are we happy about this year? And when somebody tells you, because of this project, I didn't get pregnant this year, that is something that stayed with me and energized me. Whether it's, for example, my work in misoprostol for postpartum hemorrhage, and then we had a young man in Tanzania thanking us for bringing this drug. His work, he was a grave digger, and he noticed over time the fewer graves because of maternal deaths that he had to dig. That, and this is from a young man, and you know, making the connection of how important bringing this drug into the community was. So those were the moments, the small lessons that really energized me. Said, I am doing the right thing. I need to continue to fight because these are the people that we fight for, and they have no voice in the sort of in the whether it's the sort of a policy making, program planning, or things like that. So I felt like my role was a connection between them, and then in my humble way, their voices will be heard in sort of the structures that make decisions about the programs that we put in place to save women's lives.
Wow, thank you. When you talk about hard work and the stories that propel us forward, I can so relate to that. I can think about so many times when I personally felt like it was just too hard to keep going, trying to propel We Care Solar forward. And you have a story from an individual who will tell you that, you know, there was an outbreak of cholera and the lights that were in that village clinic allowed them to save the lives of mothers, fathers, and children. And you go, oh my God, I can't stop. Like, this is really saving lives and I have to keep going. So I really appreciate what you're doing and the stories and can relate to that. Maame, you have made your life mission really building women leaders, really trying to support leaders. And I know that you've had a lot of time to reflect on lessons. Could you share with us some of your learnings?
Yes, yes. Thank you, Laura. So for me, one of the biggest lessons I have, it's actually encapsulated in a quote. And I say, life begins at the end of your comfort zone. And that statement, you know, really means that you start to look at your life differently. It's a mindset shift that happens once you embody that idea that your life begins at the end of your comfort zone. That means that you bring a lot of courage, you bring a lot of audacity, you bring a lot of bold and visionary leadership to who you are being and how you want to be in the world, right? And with that perspective, it really shifts you to think about legacy. It really makes you think about intergenerational, you know, an intergenerational mindset, right? And I think for me, when I think about this idea of stepping out of my own comfort zone, it makes me realize that courage is contagious. Courage is so contagious. So I see myself working with a lot of the people I mentor, people I coach in the spaces where I work with young leaders, women leaders, all kinds of leaders, right? And I see that when I show up with that boldness, right, the energy I bring, the audacity I bring, it spills over. And then I begin to see how other women begin to walk boldly in their own calling and in their own purpose. And nothing brings me joy than to see that I have become a conduit, a catalyst for somebody to step into their own space of leadership. I have numerous stories of, some of them are even on this call, of women that, you know, I call it calling out the gold in people. How do you call out the gold in people? Sometimes people may not even see for themselves the gold that resides inside of them. But when you have gone through a process where you can show up so boldly, you know, with your own leadership, you bring, it makes it contagious. Hope becomes contagious. Courage becomes contagious. Audacity becomes contagious. And I think for me, just even going out of Ghana to end up in Iowa, in the middle of nowhere, and I remember I was crying, I was like, I want to go home, I don't want to be here, you know. I got to Minneapolis airport and all I saw was corn, cow, you know, driving from Minneapolis to Iowa, corn, cow, beans, and Amish, you know, and, you know, just getting used to the weather, all of those things. It built a certain kind of resilience. But because I embody that, when I'm with some of the people I mentor and in the spaces that I'm blessed, you know, to speak into, that shows up, and it goes to the idea of authenticity. So it's not something that you are just performing it or checking a tick box, you know. It is coming from inside of who you are, because these are lived experiences. And sometimes even school education education, as in like school and reading, doesn't give you that. You just only have to live it. And once you live it and you start to embody it, it spreads out like wildfire, you know. And imagine the number of women who will benefit from that when that spreads out. And then the other point that I want to make in terms of the lessons and pathways that, you know, lessons that have become pathways for my leadership is this idea of core values. I think it is very, very important to know who you are. In today's world, there are so many voices telling us about what leadership is and giving us examples and snippets of leadership. And not all those voices are rooted in the right values. And so you have to ask yourself what I call essential and critical questions to know who you are. That's where reflection comes in as a leader. You have to ask yourself, who am I and why am I here? Those questions go to the heart of your why, because when you know your why, it informs your what in a very meaningful and practical way. And so for me, though I constantly, as a lifelong learner, I constantly ask myself these questions. How does my life matter? Why am I here, right? What will future generations think? Like, how will future generations be better because I showed up on this green earth? How will life be different for other people because I brought my full self? And in going through this process, you know, I have gotten to know at the core who I am. And one of the things, if you know me, you know that I am a consummate networker and a connector. Like, you know, and I have a wicked sense of humor. I'm really crazy in a good way, right? So when I step into a space, you know, I'm in the space just because of the energy I bring. But those things are rooted in my core values of stewardship. I talk about stewardship all the time. And for me, stewardship is important because it's basically telling you, you have been blessed to have opportunities, to have access points, to have doors open to you. How are you stewarding those opportunities? How are you stewarding those access points and using them as platforms for other people to step into their own calling and into their own leadership, right? To bring transformative change, to bring sustainable change, to bring meaningful change in the lives of people. And sometimes leadership, I think it's not even about what we do. It's not about what we do. It's about how we allow people to show up. Sometimes just allowing people to find their voice, just facilitating process so that people will know the gifts that they are prepackaged with, just finding themselves. For me, sometimes leadership is as simple as that. And in my work, I have seen that facilitating a process for people to just find their voice, know who they are, appreciate their identity, look at their gifts and their passion, and just begin to tap into that and use it for their community, for themselves, is the heart of leadership. There's a quote I love from Lema Bowie. She's from Liberia. She won the Nobel Peace Prize in 2011, along with the first African woman head of state, Mama Sirleaf. And Lema says that she talks about footprints and tiptoes. And for me, I look at leadership as living footprints. Lema says, if you are always on your tiptoes, you can never leave footprints. If you are always walking on your tippy toes, you can never leave footprints. So when I think of leadership, I think about footprints. What footprints are you leaving for people to come along with? And then the last point I will make on this is this idea that, you know, it speaks to the authenticity and authentic leadership. What we do is just as important as how we do it, right? And for me, that brings about the idea of lifelong learner, making good trouble. And Ndola, you talked about you are the troublemaker. The late Congressman Lewis says it's good to make good trouble, right? Let's make good trouble. And I made a lot of great and necessary trouble growing up because I was always asking questions. And if you know some of the culture, at least in Ghanaian culture, if you are a girl in the first place and you ask a lot of questions, they tell you, no, you talk too much. Stop asking questions. Why are you always asking questions? And I always ask questions. And because I was always asking questions, which I still do, but why? But why? But why? Tell me this. And my mom would be like, man, why do you like asking so many questions? That has helped me to be a lifelong learner. And that actually helps me to step into my authentic leadership, where I'm not performing, but I'm bringing all of who I am to every space. I'm bringing intentionality and being thoughtful in my leadership.
Maame, thank you. Thank you so much. When you were talking about asking questions, you really reminded me of something very funny, which is that when I went to college, I was going to be a piano and dance major, nothing to do with medicine. And I needed to have reproductive health surgery. And I kept asking the doctors questions and I kept asking them, and I had a surgery and I asked them right afterwards, like what they found. And the doctor said, if you have so many questions, why don't you become a doctor? And that's why I went into medicine. The next semester, I took my first science class. So I think asking questions is powerful. I want to turn to some of the questions we're getting from people who are on the call with us, because I think some of those questions are really related to things we're now talking about. Anne-Marie Sevcik, who's from Switzerland right now, was talking about the fact that so many women right now are super smart in United States and Washington, D.C., and they're saying, why is it only that men are putting themselves forward for jobs in the new administration? Why are women not self-promoting? And I was thinking about, we did the Power of Women a few weeks ago with women installers, and the women were talking about the fact that as children, they were never handed tools, that fathers would typically do projects and the tools would go to the boys and not to the girls. And I'm thinking about listening, as I listen to both of you, what are the tools that we need to give to young girls to be able to have that power and to have the voice and to feel like they should be stepping up rather than waiting to be invited? Are there things that we are not giving our young girls right now that we could be giving them to really change the dynamics that we see in adulthood?
Well, Laura, if you allow me to start with this one, I think for me, and also looking at what's going on now and my own experience, I think that all of the tools, equal opportunity and equal rights for all genders since they're very young. So we all grow up with this ability to, I can do anything, right? Than others can do that is not associated with gender. So that is very important to break those barriers early on in childhood, but also establish ways and processes to bring women out of some of that sort of a cloud that might have been during their childhood, that they didn't have the ability to participate in certain areas that were sort of a quote unquote dedicated to men, or men would tend to be in those positions. So working with the young people is important to do that. And for all of the young women out there thinking about doing something that is beyond sometimes what the expectation, either family expectation or society expectation, it is important to follow that and think about not just about yourself of following your dream, but also think about other little girls that will come and see you breaking those glass ceilings and then making some head waves to get there. I also wanted to mention something that I didn't mention with respect there are lessons learned with respect to leadership is that even it doesn't matter what level of leadership you are, never assume you know everything. Never assume you know everything or sometimes anything about the sort of a population or a specific group that you're trying to bring about change. They know better than you 99% of the time. You can bring new knowledge, new technology, but how to do it, they know it. And being humble about that, I think is also, I hope Maame, you agree with me, it's also a good lesson that I learned, but also good characteristics that leaders should have.
I think that's a really excellent point. We were talking about before this call about what brought you both to the We Care Solar board. And Maame, it seems like a number of things Ndola was touching on right now were things that when you and I were talking, you were talking about part of your mission with We Care Solar. Could you elaborate on that? And you'll need to unmute yourself.
Yes, yes. And, you know, before I speak to that briefly, I just want to add one more thing to the point about, you know, how we help other younger people, right, in leadership. And I think the word being a role model is very, very important. What are the examples that people are seeing? For example, like, how do you take care of yourself as a woman leader? This issue of self-care, because sometimes, you know, we use the master's tool to destroy the master's house, as somebody, you know, as a quote, right? And so how are you modeling for people what it means to be a healthy, powerful, bold, passionate, a leader that brings inclusiveness, a leader that has empathy, a leader that has compassion, somebody that leads with kindness and honesty and truth? How are we modeling those for people? Because, you know, you can give people the tools, you can give them the equipment, but if they don't have the manual to use the equipment, it's meaningless. And in women's leadership, I believe that, you know, the tools are the things we say, but the manual is how we model it. And so think about yourselves as individuals in your different spaces that you sit with, for all of us on the call. In your spaces as a leader, how do you use your voice? How do you model self-care, for example, for the people you work with? Are you always burnt out? Are you always stressed out? You know, do you have, I don't like the word balance, but for lack of another vocabulary, we use balance, right? How do you balance those things? How do you show up? And so for me, it's about, there are three words: engaging, equipping, and inspiring. Those three words are ways that I look at for building leadership, for growing emerging leaders, and engage them differently, to different perspectives, equip them with the tools and the skills and the resources, and then inspire them through your role model. These days everybody talks about mentoring and coaching. There's another dimension, which is sponsorship, right? Sponsorship is about, how do you hold somebody's hands and put them in the spaces and become an advocate, become an ally for them, and put them in those spaces so that they can function and they can thrive and they can flourish and they can have an ecosystem of women leaders. So if there are just a few people in those spaces, how do we change that, right? So enough of that. Let me talk to your point about being on the We Care Solar board. For me, being on the We Care Solar board resonates personally. I tell the story of my little sister who had, you know, she lost 2 babies, like, you know, in 2 pregnancies that she had. So when her 3rd pregnancy came up, I decided, okay, I'm going to Ghana, and my mom had passed away, so it's just myself and her now. So I was like, okay, I have to be mom, you know, and go to Ghana and go and be with her. So I went and I was in Ghana with her and just, you know, helped a month before she delivered. But after she delivered, you know, and just when we're getting out, my niece had jaundice. So we had to go to one of the biggest hospitals in Accra. And what I saw firsthand when it comes to maternal health and pediatric health was mind-blowing. You know, the lack of resources, the lack of systems, you know, even the kind of dignity that a woman would have, you know, giving birth. I saw that those things were not there. And that shifted my idea. And, you know, in Ghana, at one point, we had this system where they were rationing our electricity, where they would have one section will have light from 6 a.m. to 6 p.m. and then your lights will go off. They were rationing the electricity because we didn't have enough access to electricity. So imagine for women who are giving birth. So for me, this idea that women can give birth and deliver and have maternal health with dignity, it's very important, which is the mission that we are on at We Care Solar. And I'm really inspired by our initiative, our ongoing initiative called the Light Every Birth Initiative, which blows my mind. And I remember sitting in board meetings when we started talking about it and talk about women being bold and audacious. You know, sometimes when you don't speak the word, let me rephrase. Sometimes when you speak the word in boldness, it allows things to follow and it makes it reality. If you keep it in your head, nothing will come out of it. So I remember several board meetings where, you know, we're talking with Laura and having the conversation and we're like, do we make this bold statement? Do we make this bold statement to light every bed? That's huge, right? But once we embrace that boldness and we step into that audacious and courageous part of who we are as leaders, you know, we've been on a journey now. And, you know, I'm sure Laura will tell us more about it, but I'm seeing how our work in Tanzania, in Uganda, in Liberia, in Sierra Leone, in Zimbabwe, to light every bed, what that means, building a movement, basically, to bring different voices to the table and to sound the alarm that reproductive health rights of women is so crucial. And, you know, knowing that within the continent, so many women die in childbirth. And, you know, as we say at We Care Solar, no woman should die giving life or bringing life into the world. No woman. It is not right to lose your life whilst you are bringing a life into the world. And so that really inspires me, you know, in terms of my work. And then the other thing that, you know, inspires me in terms of our work is our value and emphasis and the priority we give to inclusiveness. And so how do we make sure that from our donors to the people, the communities that we are working with, to our staff, how do we reflect the face of the space that we are working within and bring in those voices? I think one of the amazing things about women's leadership and you know, to Laura's leadership as co-founder and the ED of We Care Solar is this idea of being able to be very inclusive. You know, Laura is always thinking about, it's not just bringing different voices, but how do people feel when they are in the room? How do they feel when they are in the table? Do they feel seen? Do they feel heard? Do they feel valued? Oftentimes, I have seen that in our work, a lot of the lessons we've learned have come from the communities themselves. And so the local experiences and expertise of the communities. And I think We Care Solar is doing an amazing work championing a community-based approach to leadership and development, right, within the reproductive health space. So these things really inspire me. And, you know, I talk about We Care Solar with a lot of passion, with a lot of love, with a lot of pride, because what we are doing is life-changing, it's life work, and we are we are really on a radical, bold mission to light every bed. And I hope that all of you, will kind of continue to stay in touch and join us on this journey. We want to build a movement. So
let me just interrupt. It's about 10 o'clock. We're going to still stay on for people who want to continue the conversation, but I know some of you may have other obligations. So for those of you who can't stay, we thank you for being here. For those of you that can stay, I want to keep the conversation going. Two things. One, you'll see that Leslie just put in the chat box a link to our Light Every Birth petition. We did start a movement, Maame, and that mission is to really call for the rights of every woman to have access to clean, safe childbirth. And we are going to be trying to share this petition with United Nations. So by just signing your name, you will really help us. You will be part of this movement to light every birth, to show that in the 21st century, it is unconscionable that women are still needing to work in darkness, that health workers are trying to save lives where they can't even see the patients in front of them. So please sign our petition. Ndola, you mentioned it takes a village to make a leader. I think it takes a village to be a leader. And Maame, you credited me, but it's my team. I mean, there really is only so much a person can do on their own. And it really is by linking with other people that we do make change. And there's a number of those people who are on the call right now, who are part of our team, who helped take, my fairly confined vision and help me believe that it actually could be expanded, that we could create national programs. And from that type of a village, we actually have been able to reach every public health center in Liberia. Every woman in Liberia now knows that she can reach a facility that does have light, that does have electricity, and the same for every public health worker. They know they don't have to go to work being afraid of the dark, being afraid that they won't be able to see their patients or see their equipment. And again, that takes a village. So many people are staying on. Ndola, I'd like you to respond to the question, if you would like, about being part of the board. And then what we'll be talking about is what kind of advice we might have given ourselves when we were younger. And I'd like at that moment to actually open up to the gallery view and let anyone who wants to turn on their camera and actually be part of the conversation. So Ndola, if you could just spend a moment talking about your role with We Care Solar, and then we'll open this up to be more of a conversation.
Yeah, thank you, Laura. So I'm actually a recent addition to the board, but I have been following the work of Laura in the beginning, the establishment of We Care Solar, and where We Care Solar is today, with great sort of admiration and pride. So it is an honor for me to serve on the board. What I bring to the board above everything else is my passion and my sort of a commitment to improving maternal health. And, under the banner, every birth, should have light. And so everything that I have learned from my work in maternal health, I bring to the board, but also other aspects of things that I can help in terms of, because of my background, designing indicators, how to measure as we move forward, what specific and single contribution can having light make in, for example, maternal mortality or even disability. What sort of how does it impact healthcare workers in their engagement, in their motivation? Because as being a physician and having worked in very sort of resource poor settings, I know that is very discouraging. You know what to do, but you don't have the basics, like, for example, being able to see what you're doing. So that's very important, and that's also what I bring to the board, in addition to everything else that the board needs me to do in the area of advocacy, policy development, discussions with sort of ministers of health, governments, including local governments and women themselves, women's groups, about, how can they also advocate for themselves when it comes to improvements in the delivery of healthcare system.
Thank you. So I'm going to ask everybody now, if you would like, turn on your cameras. Christina, if you're still on the phone call, let me invite you to actually ask the question that you had.
Hi, this is Christina.
Okay.
Thanks, Maame. Thanks, Ndola. This has been a very interesting conversation, and just really appreciate hearing your insights.
Go ahead.
I was wondering if you, thinking about your career and looking back, are there any things that you would have done differently, or what advice would you kind of given yourself early on in your career?
Well, I will probably, of course, looking back, there's many things that I know now that I could have done differently, but that I didn't know back then. But one thing that I would say to myself, don't be afraid to be bold. Mm-hmm. Don't be afraid to challenge, and do it with conviction. But study the audience that you want to basically affect, and have one single sort of a group in mind when you make your arguments, and that is, how will this benefit the poor? How will this, meaning what you do, benefit the advantage? How are you contributing to equity? And that is very important. And sometimes, our careers are not linear, they drift a little bit, but it is important to always have your North Star. That sometimes, even in my own life, shifted a little bit, reprioritize things. And just for the young people in this in this call, because I see a lot of young faces, is that don't be afraid to ask for more. Ask for, do things at the same time. You can be a great leader while being a great mom, and by being a great wife and a family member. Of course, there are sort of a trade-offs that you need to do, and don't even be apologetic to the career that you map for yourself. You can do everything. And for everybody that is here, and actually Anne-Marie had a very good question. How do we help ensure women get a chance to be leaders? We can all contribute if we pay attention to every single one around us, in the family, in the neighborhood, and do small things, even if it's just words of encouragement. Because sometimes, and I say that from my own experience, it's just what I needed to continue the fight. Encouragement, I am with you. Continue to do what you're doing. What are you missing? Okay, I can take care of your baby tonight if you want to come, if you want to work a little bit more. I can put water in your plants. Maybe I bring you a little bit of food. I cook for you tonight. Small things that every single one of us can do, that can support and allow sort of young women specifically to get a chance to be a leader.
And, I'll add to that to say, don't be afraid to fail. I think a lot of us are taught to always have it correct. Everything has to be great. And so when you are afraid of failure, Ndola, to your point, you don't step out of your comfort zone. You don't ask questions, right? So don't be afraid to fail too. The idea of have an abundance mindset. I think somebody asked the question about sisterhood. I think one of the things that sometimes we have that hinders us from building authentic sisterhood and authentic relationships, because we don't have an abundance mindset. So instead of supporting, we come from a place of scarcity. But you have to understand that in who you are pre-packaged with everything you need to do and be who you are. So in your leadership, in your work, whatever your passions are, you are pre-packaged with that. So with that abundance mindset, you move from a place of sabotage to support, a place of competing to complementing and collaboration, a place of critique. Sometimes we even critique our own selves. How much do you love yourself? How much do you care for yourself? We critique our own selves, and because of how we are self-critics, we have to move from self-criticizing to self-compassion. And with that self-compassion, that allows us to show empathy to other people. So, and then I will say humor, Christina, have fun. Some of us are too tight. Just let your head down. It's okay. Don't take yourself seriously. You are not all of it. You are not it all. Have fun. Have a wicked sense of humor, and that connects to your well-being. I always say that well-doing is always inspired by well-being. You can't do good when you are not doing well. And sometimes, one of the things I have learned is that sometimes just even taking care of yourself can be in a few things. Saying thank you often, saying I'm sorry, right? And saying I see you. Thank you, I'm sorry, I see you. Just having a habit of going through these things can make a big difference. And so, those are the things. Don't be afraid to fail. Abundance mindset. Have fun. Let your head down. Don't take. I always say, shake what your mama gave you. I'll always be dancing. Shake what your mama gave you. So have fun. Sing out loud. Like if you are walking. Sometimes I go for my walks and I have my headset on. Of course, it's a quiet area, so there's nobody around us. I'm not disturbing anybody. I'll bust out, in a move. I'm listening to a song and I'm like, okay, break it down, Maame. Work it, girl. Work it. That's it, girl. Work it, So these things are important. And I think when we bring joy to what we do, when we bring joy and we include that in how we do our work, that's where it becomes contagious in a positive way. So imagine the work we are doing is really hard. Think about the work we all do. You are talking about women's rights, reproductive health rights, social justice, racism issues, economic disempowerment, women not being seen, people left out, people being disrespected. Think about how much that puts a lot of trauma and toxicity in your system. And think about if you always walk around with your face looking so sad and, find joy. And if you are passionate about that thing, let that joy flow out. I always say, give from your overflow. Anyways, I'll stop there.
We have that was awesome, Maame. We have a couple of people who have asked questions and then we'll close it. So Malika, you wanted to ask some questions about the new administration. Why don't you unmute yourself, ask a question, and then Jay, if you're still on, I'll call on you next. Okay,
absolutely. Thank you so much, Laura. Thank you so much for such a platform. Thank you so much, Maame. Thank you, Professor Ndola. It's nice seeing you again. My question is a two-part. The first is, what would you, as We Care Solar as a whole, like what kinds of priorities would you like this new administration here in the United States? What kind of priorities as far as women's issues would you like them to take on? That's my first question. Two, strategic allyship. I'm African. I was born in Kenya. I live in the US right now. I've lived in Brazil as well. But again, I would like to be a better ally. And I guess I'm asking the question for all men. How do we support women strategically and without seeking to take any limelight or glory? Like, how do we help push the cause forward?
Excellent. So the first question was really about what we would ask of priorities of the new administration.
Exactly.
Ndola, do you want to speak about that from a reproductive health standpoint?
Yes, thank you. Well, from a reproductive health standpoint and also maternal health is just paying the necessary attention. So I'm going to divide this into what's happening here in the US and also globally. In the US, paying the necessary attention to the issues related to maternal mortality, specifically the increases and the differences that have widened between the Black women and other races in terms of maternal mortality, as we know is increasing. So pay sufficient attention to that, like really put the resources to decrease racism in maternal health, but also provide once and for all, institutionalize funding channels, but also the rights that everyone should have with respect to reproductive health. All rights should be attributed to all individuals that need to make decisions about their reproduction, and they need to be assisted psychologically, clinically, but also many times with funding. And I think that as a society, we'll advance a lot more and faster because we will address a lot of inequities in health in general, and while at the same time promoting women's health and specifically the health of the minorities. At the international level, I would recommend the new administration to go back to the levels of funding. US is an important funder for maternal, child, and adolescent health, specifically family planning. So go back to the initial sort of funding levels and remove a lot of the restrictions that do exist related to the Mexico City policy, the global gag rule, so that all of the good work and organizations around the world that have sort of contributed significantly to improvements in maternal, sexual, and reproductive health around the world can continue to do their work.
Thank you.
Thank you.
And Maame, do you want to add to that, or do you want to talk about strategic allyship?
Yeah, I just speak briefly about the allyship. I think in terms of being an ally, I think the first thing I always say is that being an ally is something that you earn. So it comes with building trust with people. You have to earn the right to be an ally. You're not given, it's not given to you. Here, become an ally. So to be an ally means you are invited into the space, right? And you have to build trust. You have to assess your motives. Why do you want to be in that space? And I think you also have to understand your role. What role do you need? If you don't have clarity about the role you are playing, it's very hard to be an ally. So you have to be very, very clear about your why. Why, and know your role. You have to know your role from the perspective of your strengths, your gifts, the things that you are good at that you can bring into the space to support the cause in a sustainable way. So if you're an ally and you're coming in and you also have to know your core values, right? What are your core values? And do your core values align with the core values of perhaps the movement you want to be part of, the space you want to be part of? You have to understand what the mission and the broad vision is for the particular issue that you want to be an ally for, right? So know your role, know your core values, get clarity on the vision and mission, and remember that being an ally is not given to you. It's not just something you get. You have to earn it. And that means building trust, having mutual respect, having accountability, within the spaces, and just bringing your authentic self into the space. So that's what I will add.
Thank you.
So we're going to end with one last question, which is actually a pretty challenging question from Nancy Gutierrez. She asks, as a leader, how do you encourage resistors to be part of the health project you're implementing? And Jay, who I think is no longer on the call, was asking, what do we do when women hold back women?
Mm-hmm.
So,
Mm-hmm.
I mean, you've already just spoken about allies that may have shared values. What about trying to actually change hearts and minds?
Yeah, I mean, I think this whole thing about, well, I hear that all the time, that women are their worst enemies. And over time, in my experience, I have noticed that it is not that women are their worst and are their own worst enemies, but it is rather because sometimes we do not, what's the word, take the time to understand where people fit in our relationships. I always think about relationships in different categories. So there are people, so I think about it like a tree, right? A tree. You have the roots, you have your branches, and you have the leaves, right? And you have to know what each represents. And you as a person, you are the trunk. You have to know what each of these represents to make the tree what it is. So your roots are usually people who are your confidants, right? People who feed you, and they, you know, they are there because they are just for you. They feed you. These are your confidants. That your root. That's what holds you down. The people who hold you down, who know you, you know, as well as anybody. And then you have your branches. These are your constituents. Often you have your constituents coming to you because, you know, they align and your mission and your vision resonates with them. And for those people, sometimes when that mission is no longer a priority for them, they may move on from your life. And then you have what I call the leaves. The leaves are they can come off anytime. They don't really have any allegiance, right? They are usually there to, like, people who come in to fight with you, right? So when the fight is over, they are gone. I think the important thing that I have learned, you know, from the perspective of this question is what you feed these categories in your life. Like, first of all, do you even know where people fit in each of these categories? Because if you don't know where they fit, you might be feeding people the wrong information. So something that may be meant for your confidence, you feed it to somebody who is in your acquaintance, which, like the leaves, right? They are your acquaintances and stuff, right? You feed it to people. So sometimes you are feeding people the wrong things, right? So you have to learn, where do people fit? How do people put me in their lives? Where do I fit in their lives, and where do they fit in my own life? That is the introspection and reflection process. When we don't do that, and then, you know, you think somebody is your confidant, but they were actually just a constituent. And then something has like, oh my God, she disappointed me and she betrayed me. No, they didn't betray you. You did not do your homework of recognizing where people fit, right? And you have to give yourself some grace going through this. I think sometimes we are hard on ourselves when it comes to sisterhood, you know, and if we are not gracious first with ourselves, we can't extend grace to anybody. Sometimes we have high expectations of each other. Manage those expectations. You know, that way you won't be disappointed. And if you have gone through the process of reflecting where people fit, you will know what to feed the right people in your life, so that you are not feeding the wrong information to the wrong people and vice versa. So that would be what I would say. I hope it makes sense.
And Ndola, thank you, Maame. I know this is going on, but you are someone that really has had to change minds around policy in your work. So maybe you have something else to offer about how do you take adversaries and convert them into allies?
Yes. Well, my strategy has been, and of course, you know, you learn along the way how to perfect sort of your strategy, but it has always been, you have to understand them. You might not agree with what they say. You need to really study them individually, because each one of them, if it's a committee that is, for example, decided on some very important aspects that can affect millions of women around the world, it is important that you understand them. Why are they against you? And then start to break down and use your power to best sort of dismantle some of the arguments that they have, so that at some point they are like, oh, okay, so I can see this. Of course, not if it sometimes the majority will slowly start shifting with you. Allow for time. Change takes time. It is what I also learned from my journey, is that you'll find people that have been 50, 40 years on the job doing the same thing. And even though there is no success, when you point them out what can be done so we can make faster progress, they understand that you're right, but they resist the change. So knowing how to go about allowing the opposition, in my specific cases, to change slowly, save face at the same time. So not always be combative. There is a place for battle, and there is a place where you actually have to be on the background. I have to tell you something that I saw yesterday on TV that I was just like laughing and crying at the same time. Obama in his 60 Minutes say that there were times of very difficult discussions in the Senate that he would send Joe Biden, or President-elect Joe Biden, to discuss, because he thought it would be more effective, given that they didn't want to face a Black man with a name like he has, a Muslim, and all of the other things that were going on in the country. And I started to cry because, oh my God, how many times I had to do that, right? To train others, to collect or to identify more allies and train them, and they would, so you will be like the back of the pack that is moving slowly in order to make change. It takes a lot out of you, because you can always think, well, I can explain this better because I know this. I've been working on this for 15 years. No, let it go. Let's slowly. And even if they make some mistakes, you come and you clean up the mistakes and continue to move forward. If the goal is to make change, it cannot be about you. And that is something that sometimes we see in leaders. Let me not show many examples, but that you all know and have experienced, that when it becomes about you, most likely you're going to lose the fight.
That's right.
This discussion has been amazing. Your insights, your reflections have been so valuable. It's been an hour and a half. We went really half an hour over because I didn't want to stop the discussion. But I think everyone who's on this call can understand why We Care Solar is so grateful for your leadership, for the beacon of light that you give to all of us, for your partnership. And many people have been writing to me telling me how much this session has meant to them. So thank you both for all you do. Thanks to everyone who has listened. Next week, we have another amazing session. It's our final webinar. It's on the power of scale, and we have an audacious and bold leader, Samantha Parsons, who is our Chief Operating Officer, who is going to be hosting that session, where we'll be talking about how we take a small seed of an idea and nurture it to become a national or international movement. So please join us next Thursday for that. Thank you all very much. We will be sharing this recording with you. And again, sign the petition to help us light every birth. Thank you, everybody.